Hello, my name is Georgette. I'm a consultant plastic surgeon and I'm based at the Nottingham Breast Institute in Nottingham in the United Kingdom. The reason I actually went into breast oncology is because I had an interest in the inequalities that women faced. In particular, it became apparent that women of colour had worse outcomes in terms of their overall survival, in terms of the stage in which they're presenting. So my research interest is actually looking at the reasons why that may be. So breast cancer is a really prevalent disease. 1 in 8 women, and some are revising that estimate now to around 1 in 7 women, will have a diagnosis of breast cancer in their lifetime. What we are seeing, however, is that the majority of women are actually surviving that diagnosis and living for many years beyond. However, there are still ethnic disparities in the outcomes. So we have seen that Black women have worse outcomes in terms of their survival. They present in a later stage and therefore will require more aggressive treatments in order to try and achieve a long-term survival for them. So that was really the impetus behind the Let's Talk About Black Women and Breast Cancer conference, because it's an issue that is still quite taboo in many cultures. Black women are a broad spectrum, and we felt that if we had an initiative which targeted them directly, hopefully we can make some inroads in addressing those inequalities. So Let's Talk About Black Women and Breast Cancer came about because there was a group of enthusiastic individuals who were really, really keen to try and see what we could do to try and improve the outcomes for Black women generally with breast cancer. And this is a mixed group. It's not just healthcare professionals. We've got breast cancer survivors, and we've got people that have supported Black women through breast cancer. We started it last year. We had an in-person conference, which was sponsored by many companies, including Endomag. And we were able to have over 200 women register to come and just really learn about things that can be done to try and improve outcomes. This year, unfortunately, due to COVID-19, we're unable to have an in-person conference. But however, that has really opened up the opportunities for us for something that we didn't even dream we'd be able to do, which is have this international conference in which we're able to hear about the experiences of women all around the world and what initiatives are in place to try and improve the outcomes generally for Black women across the globe. So I think that's a really good question. And I think that there are going to be geographical reasons in part for that. So if I look at the United Kingdom in particular, do we have a lot of data on this? No, we do not. A lot of the information we have is fairly old, and we don't have up-to-date research on the actual figures and the actual outcomes. A lot of the information that we have, a lot of the research that we have actually comes from the United States, and we know that in those circumstances where you do have to fund your own healthcare, there may be differences that are related to access to care there. And certainly this conference is looking at the international picture, and we've got speakers from Africa, from the Caribbean, and again, I would expect that there will be barriers towards accessing, not only accessing care, but the kind of care that they're going to receive when they do present. So there's a lot of research going on in generally for breast cancer, and there's a lot of interest in this topic. We know that Black women are more likely to have something called a triple negative breast cancer, which means that they do not produce an estrogen receptor or a HER2 protein for which we have targeted treatments. So there's a lot of basic science work going on there to look at, are there things that we can now generate that we can use to treat this particular form of cancer? So I think that what really needs to happen is a bigger engagement in terms of participants in trials. And we know that it is quite difficult to recruit people from a Black or minority ethnic background into trials. So one of the things that we talked about at length at the last conference, and hopefully we're going to raise that again at this one, is participant in trials. Research has shown that if your healthcare professional spends that time to talk to you about why it's important to be part of that trial, women are more likely to take it up. So we're definitely, that's something that I think that we need to try and engage more with. It's understandable why people don't want to engage, but I think that it's incumbent upon us, particularly as healthcare professionals, to really sort of get into the reasons behind that and try and reassure the patient that things are being done in their best interest and also in the best interest for women coming behind them. One of the things that COVID-19 has brought to the fore, again, is the ethnic differences in the way that people are responding to diseases, and it's generated an interest in acknowledging that we are not one sort of homogenous group, and that in order to be able to really truly have an equitable health outcome, you need to represent the people within your population. So in terms of general health, okay, so things like weight, diet, exercise, these are all critical things to help reduce risk reduction generally across the board. In addition, self-examination, be breast aware. We know that Black women do present younger outside of the screening age, particularly in the UK. Our screening age is 50 to 70, but about 50% of Black women present younger than 50. So you need to know what's normal for you, so that when you examine yourself and you feel a lump or you think that something's not quite right, you can present promptly to a healthcare professional to have that investigated. We need to engage with the screening programme. The point of the screening programme is to be able to pick up cancers at an earlier stage. The earlier you get the cancer, the better your outcomes are long term. And then I've already talked about participating in research. It's very important. If we are not represented in that research, then it means that the outcomes may not necessarily apply to us. And we're seeing that there are disparities already. So I think there's a variety of things that we can do, but certainly I think the science needs to catch up with us. We are behind on that. We're all over social media, so you can find us on Twitter, Instagram, and Facebook. We've even got a hashtag BWBC 2020, and there will also be a link at the end of this video.